Pelvic pain is one of the most common reasons women head to the doctor, but honestly, it's often a real puzzle to solve. So in this explainer, we're going to piece together all the key info you need to start making sense of it. Welcome to MediByte. Our whole goal here is to take tricky medical topics, just like this one, and make them super clear and easy to understand. We're going to walk through it all together. So if you've ever felt that discomfort deep in your lower belly, you know exactly how disruptive and, frankly, how worrying it can be. You are definitely not alone, and figuring out the why is always the first step toward getting some relief. Okay, so here's our game plan. We're going to build this up step by step. First, we'll define what pelvic pain actually is. Then we'll dive into all the different potential causes. We'll cover the really important urgent signs to look out for, what you can expect when you see your doctor, and finally, we'll look at the different ways to find relief. All right, let's start with the absolute basics. What exactly do we mean when we say pelvic pain?
In a nutshell, pelvic pain is any kind of discomfort you feel way down low in your abdomen. Now, this area is a pretty crowded neighborhood, right? It's home to your reproductive organs, your bladder, and parts of your digestive system. And the pain itself, it's not one size fits all. It can show up as a sudden, sharp stab, or it can be a dull, constant ache.
Now, here's a really key distinction that doctors make. If that pain sticks around for more than 6 months, it gets classified as chronic. And that's not just about how long it's been there. It's a signal that the diagnosis and the treatment are probably going to need a much deeper dive.
So the million-dollar question, what's causing this pain? This is where it can get a little complicated, but we can make sense of it by splitting the causes into two main categories.
So on one hand, you have gynecologic causes. These are all related to the reproductive organs. Think uterus, ovaries, that sort of thing. And a lot of the time, they're tied to your menstrual cycle. And then on the other hand, you have non-gynecologic causes, which can come from any of the other systems hanging out in the area, your urinary tract, digestive system, or even your muscles.
Okay, let's look at the gynecologic side first. You're going to see some familiar names here. We're talking about things like menstrual cramps, of course, but also endometriosis. That's when uterine tissue grows where it shouldn't. And things like ovarian cysts, pelvic inflammatory disease, or PID, and uterine fibroids.
This really shows you just how interconnected that whole region is. Sometimes the pain has nothing to do with the reproductive system at all. It could be digestive, like with irritable bowel syndrome or IBS, which can cause cramping that feels a lot like pelvic pain. Or it could be coming from the urinary system, like a classic UTI. Or it might even be musculoskeletal, starting in the muscles and tissues of the pelvic floor.
Okay, let's switch gears for a second to something really important. Most of the time, pelvic pain isn't an emergency, but sometimes it is. And it is absolutely vital to know the warning signs that mean you need to get help right away.
First and foremost, if the pain comes on suddenly and feels severe, that is a major red flag. This isn't something to just wait and see about. It could signal a really time-sensitive problem, like a ruptured ovarian cyst.
Here's another huge warning sign: feeling lightheaded, weak, or actually fainting on top of having the pain. These are classic signs of shock, which could mean there's internal bleeding. That is always a medical emergency. And pay close attention to your temperature. If that pain comes along with a high fever or chills, it's a strong sign that your body is fighting a pretty big infection. We're talking something that might need urgent treatment.
And finally, this is a critical one. Any vaginal bleeding after you've gone through menopause is considered abnormal until a doctor tells you otherwise. It has to be checked out right away to rule out anything serious.
Okay, so you know the signs that mean you need to get to a doctor. But what actually happens when you get there? It can feel a little intimidating, right? So let's just walk through the typical process so you know what to expect.
One of the most important tools a doctor has is your story. They're going to want to know all the details. So it's a great idea to think about these questions beforehand. Being able to describe the pain, the timing, and anything else that's going on can give them some really crucial clues.
The evaluation itself usually follows a really logical path, starting with the least invasive stuff. It all begins with your medical history and a physical exam. Then, your doctor might order some basic tests, like a pregnancy test, urine, and blood work. Next up might be an imaging scan, usually a pelvic ultrasound, to get a look at the organs. It's only if the cause is still a mystery that they might consider something more involved, like a minimally invasive surgery called a laparoscopy.
Ultimately, all of that detective work is meant to lead us right here, to finding a path to relief. So let's take a look at the different kinds of treatment options out there.
What's so interesting here is how personalized the treatments are. For menstrual cramps, sometimes an over-the-counter pain reliever is all you need. For pain that's driven by hormones, like with endometriosis, hormonal contraceptives can be a game changer. Physical therapy is an amazing tool for muscle-related pain, and there are even specific nerve medications for certain types of chronic pain. Surgery is usually for structural problems, like removing fibroids.
And that really brings us to the most important point. Knowledge is power. The more you understand what could be happening in your own body and how to talk about it, the better you can team up with your doctor to find the right answers for you.
If you take away just one thing from all of this, please let it be this. Pelvic pain is not something you just have to live with. It is a real signal from your body, and it deserves attention. Please advocate for yourself and talk to a healthcare provider.
Hey, if you found this explainer helpful, we'd so appreciate it if you'd hit that like button, share this with someone who might need to see it, and subscribe to the MediByte channel for more clear, trusted health information. Thanks so much for learning with us.